Last time we learned about the upper respiratory system. We touched a little bit on sinusitis, tonsillitis, um, and the viral infections that can affect that particular area, bacterial infections that can affect that particular area. We also talked about some of the myths surrounding ovulity, uh, ovulectomy. Ovulectomy is just for those who are not there because of the inflammation. And I think that was something that was culturally adapted by the Kikuyus. And I don't think it's only the Kikuyus, most of the African cultures, they had that kind of myth where they thought they can be able to cut the uvula, and then at the end of the day, cough would reduce to some extent, because there is some truth about it. Because when the uvula is infected, it takes a little bit longer to get healed. But now, when you remove it, you're leaving that particular area very exposed to foreign bodies. So rather you have your uvula in place than have foreign bodies launching on your windpipe. Now, today we are going to touch a little bit on the mid section of the respiratory system. And the mid section we usually talk about between the area between the pharynx and the junction to the two lungs. So there, the most critical issue is usually infection and irritation secondary to foreign bodies or foreign smokes or chemicals. And at times, especially for people who are unconscious, irritation due to things like dentures, that is for teeth or foreign or food particles that usually can pass into that particular area. And at times, for those who drink excessively, we've had when somebody has blacked out, they have vomited, they start aspirating the vomiters. So that vomiters getting into the windpipe, because of the acidity and all that, it causes a lot of corrosion, and it can be really something else. And of course, if it's the vomiters from the stomach, it doesn't only go there with the acid. At times, even some bacteria can be transferred from the from the gastric, or from the stomach, from the gastric juice, into the trachea, which can be very, 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 very irritating. Now, while I'm at it, at times it's very difficult to differentiate between the pain secondary to hyperacidity for gastritis and pain secondary to the inflammation of the trachea. The only difference sometimes is usually the fact that when you're talking about windpipe, there's always some kind of irritation, and there's always some cough. But when you're talking about gastritis, rarely do you usually get anything to do with cough, but at times you can still be able to get it. But now the cough that you get secondary to gastritis is usually because of the gastric juice either affecting the upper respiratory tract areas, that is around the pharynx area. So that is why when you belch and you get that bitter taste coming to your mouth, it also irritates the organs around the upper respiratory tract. But when that happens, and could be it goes beyond there, and then it gets to the trachea, then that means so many other things can happen, and that is usually critical and something ought to be done. That is where now part of management is usually to make sure physiotherapy of the lungs is done, and drainage of both the lungs to get rid of the foreign body or the or the vomiters is done, so that at least the irritation gets out of the way. Now, I want to get to the main gist of the matter today, which I want to talk about, and it's usually the matter, something to do with the lower respiratory tract. So when you're talking about the lower respiratory tract, now you're talking about the lungs per se. And this is where most of you talk about, is when most of you, when you're talking about things like pneumonia and bronchitis and things like that, is all those are located in the lower respiratory section of the respiratory tract. Now, so many things can cause issues within the respiratory tract, in the lower respiratory tract. First of all, we'll start with the most common ones. The most common ones are things like viral. One of the most common ones that we can really talk about is what kept us at home in 2020, that is COVID-19, which is a virus. And not only COVID-19, also so many other viruses. Most of them affect the respiratory system. And anything that can affect the upper respiratory tract can also be transmitted downwards to the mid-level and also to the lower respiratory tract. And after the viruses, we can talk about bacterial infections. And when we talk about bacterial infection, because you guys are not specializing in bacterial infections, we just mentioned the most common ones. For kids, we have both gram-positive and gram-negatives that can affect, and we're not going to mention them by names because I'm not intending to make you doctors, but I'm just trying to highlight a few things here and there. For adults, the same. But one of the most common infection that is affecting of public health importance to all of us, apart from those infections that most of our children are immunized against when they are young, like measles, whooping cough, pertussis, all those diseases, influenza and the like, pneumonia. Now, the other, including even TB, is one of the immunizable diseases that our children are immunized against, but it's still a public health concern to date, especially with the advent of the era of HIV. Now, before the advent of HIV, nationally, most, I mean, at the national level, the tally for TB before the advent of HIV, we we had like around anything. It was oscillating between 9,000 to 10,000, a little bit 11,000 patients on TB before HIV. But with the advent of HIV, that skyrocketed, and we're almost having more than 100,000 people having TB. And I know some of you are asking why, what is the reason behind that? And the reason behind that is that when people have immunocompromised, I mean, the immunity is compromised, they don't fight regular, I mean, normally the way they expected to fight. They don't fight infections normally the way they expected to fight. Now, in a normal person, when a normal person gets any kind of infection, may it be bacterial, may it be viral, usually what happens is that when the body notices that you have an infection, then it releases something we call soldiers or white blood cells to go and fight with that particular invader. So at that particular time, when the body realizes through the CD4 cells that there is a stranger in the system, then it sends some signals to the factory or to the white blood, to the other fighter cells to form, I mean, to form fighter cells. And when that happens, then the body starts producing those fighting cells so that they can come and attack the invading cells, whether it be bacteria, viral. So when that happens, usually inflammation takes place. Inflammation is just swelling, because when that they are fighting, inflammation takes place, and when this inflammation taking place, they swelling, and when they swelling also, there's a lot of heat that is produced because of the fighting, and that's when you get most of the people develop what you call fever or temperature. Your body temperature goes up, which is a sign that your body is experiencing an attack from the enemy, but it's also fighting the enemy. Now, whose immunity is low is attacked by either bacteria or virus, and now those messenger cells are not working. Then that means the invading organism can get into the body and now live there as if it belongs to the body. And that is why a while ago, old enough, you can remember, most of the people, when they were diagnosed to be having HIV, when they were started on antiretrovirus, they said, or people used to say, vile alianzishwa dawa ndio aligonjeka. Some of them, when that happened, because that is what is usually called immune reconstitution. So when that happens, then that means this particular person who has a disease that is not aware, he can stay with the disease for so long. He becomes a carrier, he or she becomes a carrier. So akikohoa kidogo, he's spreading to all those that he's getting in touch with. If he goes to a place to, I mean, if he laughs, if he sneezes, or, if they have TB, they spread it to all the people that are around there. So, vis-a-vis, when somebody who has good immunity, when they get TB, we used to talk about maximum 2 to 3 weeks. That, in fact, hata saa zingine anaanza kukohoa because the body is really fighting this infection mpaka anaanza kukohoa damu, then you know this particular individual has TB. But now, on this other person who whose immunity is low, in fact, the signs and symptoms for TB, the way you used to know them in the past, they don't appear to them. So for them, at times utakuta inakula mtu na hana signs, hana joto, hata saa zingine they are not wasted, so they're just there. And that is why um, the TB outbreak has increased since the advent of HIV. So, what is the ministry or we as clinicians are trying to do to make sure that this comes to an end? We are trying to educate people. In fact, that is why we are here today, for you to know that anytime you are treated for any kind of cough and you don't get well, or you have frequent coughs and frequent fevers and weakness and sweating at night, and instead of gaining weight, you're losing weight. Even if you're not feeling so sick, make sure you are checked so that at least we can rule out TB or any other kind of chronic chronic chest infection or infestation, so that we can be able to sort you out. Are we together up to that?
Yeah.
Yes.
Very
Now,
much.
um, TB,
Yes.
TB, TB is very, very important, and it's one of the deadliest diseases in this time and age. Though it's a bacterial infection and though it has treatment, it is still a disease that is feared. Why? Because um, currently in the modern world, TB is also becoming resistant to some of the drugs or most of the drugs that we commonly use for treatment. And that means when you are infected with a bug that is drug resistant, um, currently what you're using are only injectables. And you need to, it would be very, very tricky. You can try to imagine somebody getting 2 injections per day for the next like 2 years. It's not funny. Yeah. And that is what at times is happening when you get this kind of multiple drug resistant TB. But thank God, the scientists are trying to come up with more newer molecules which can be used orally, but they're not in the market yet. This is just work within the laboratory, and we hope they can be able to do that sooner than later so that at least you can be able to combat the multiple drug resistant bug of TB. Now, the other thing that is very critical in this time and age is something to do with matters pollution. Initially, we used to think that allergy is something that runs within the family, but we've come to realize that there are people who are developing allergy or asthma or the related conditions secondary to chronic exposure to toxins. or um, pollutants within the atmosphere or the environment. And when that happens, the body now starts forming some antibodies, and when they are exposed to these um, components from the atmosphere, then they react to it, and then they start wheezing and getting um, attacks and blockages. So it would be critical and important for us to make sure that we we do take matters pollution uh, critically and seriously, because it's affecting us, it's affecting the community, and we need to be part and parcel of the solution vis-a-vis guys who are contributing towards that. So if you can be able to, if you have a place where you can be able to plant trees, please plant many trees, as many as possible, so that you can be able to counter the many pollutions that take place because of the industrialization and the vehicle fumes that are all over. You see, and even things to do with matters construction. Because every time you look at it from, you can be able to look at it from a different perspective. Something like cement. Cement is produced from rocks and all that, but at times the pollution that is involved in that is something else altogether. And the guys who are doing construction, most of them don't even use gloves. I mean, they don't use gloves, they don't use masks. So at times they inhale those the dust, the lime dust and all that kind of stuff. Uh, and at times it affects them. It affects them. Um, just a minute. Sorry about that. So um, it affects their respiratory system, and that means at times they get conditions that are irreversible, and unfortunately, some of these conditions nobody is held responsible. And I think even when you've been around, you've seen most of the people who work with the construction industry. Uh, they don't even have protective gear, apart from could be very few who are very strict, where you just find the only protective gear they think about is could be the helmet and the gumboot. But when it comes to the gas mask or the face mask or something like that, rarely do you usually get them wearing that. Yes. I'd want to pause there and ask if anybody has a question or a concern before I continue. Anybody?
Daktari, maybe it's a. I found that it's just a comment. I found that TB topic quite. I'm sure it can go quite deeper. I don't know.
Yes.
Maybe if we could schedule a specific a session for it, whether it is possible, or maybe to emphasize more, maybe two or more sessions, because I know it can go further. And the way you said, educating the masses, I think that can also capture a lot of attention out there, because I'm sure it's something that is really bothering a lot of people. So mine is just that comment.
Okay,
Suggestion,
noted.
actually.
Mhm.
Yeah.
Thank you. Noted. Any other?
Daktari, you talked. You said that when somebody is HIV positive, they may not really know that they have TB. But although the bacteria is still there and is actually eating them, at what point do they know that they are sick if they have no symptoms at all?
Thank you. I'll handle that in a minute. Any other question? Thank you. Let me first of all go back to that. I'll start with the question that Ashford has asked. And I think I try to allude to it that some of them, in fact, most of them didn't even know. And even when we were starting the program, but over almost 25 years ago, we didn't have that knowledge. And we were wondering why are most of our patients dying, or why are some of them becoming weak when we start to take the ARVs. And much later, that's when we realized it's because they had many other diseases within them. And one of the major one was TB. So um, we saw and we realized that those when we gave them ARVs, that meant their body immunity started to improve. And when the body immunity improves, that means it starts to realize it's just like we used to give this kind of analogy. It's like when you are asleep and a thief comes into your room and you are not aware, then all of a sudden somebody wakes you up. That is now when you are waking up their immunity, and you realize, by the way, there's a stranger in my house. So what do you do? Either you start screaming or you start fighting, and that is why they used to get more sick. Because yes, the immunity is still weak, and it's becoming, and it has just been awoken. So it's not even prepared to fight with the disease. So you're getting what I'm trying to drive at. Something like that, that kind of a scenario.
Yeah.
Um, and that is why when nowadays we realized the best thing to do, because of whatever we were doing then, because HIV was a strange thing to us at that particular time. We realized the best thing we can be able to, best way to deal with it was to, first of all, make sure before you start any patient on ARVs, we needed to screen them for TB. And well, if they had TB, first of all, treat TB for at least the 2 months. Make sure that the TB bugs have been sorted out, and then you can be able now to start thinking about giving ARVs. And that is how we were able to deal with that particular thing. If there are those who are still too weak and they might not uh, I mean, they may succumb if you don't start them on ARVs. Then we put them in a program and we would advise them when you see this kind of sign, that is what we call immune reconstitution, you need to alert us so that you can be able to give them medicines, or rather medication, that would help uh, reduce the immune reconstitution syndrome, so that at the end of the day they don't feel that kind of sickness and weakness, but they can be able uh, to 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 sustain, or rather, yes, to 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 cope. They can be able to cope with the situation of the immune reconstitution syndrome, and that was really, we've seen that helping so much nowadays. At that particular time, because of the magnitude of the disease and also the stigma that was there, it's not everybody who turned positive who was put on medication. We were giving medication to guys who had a very low, or rather, yes, a very low CD4 count, and for those who had a CD4 count of more than 400, we would ask them to wait until we finish with those who had a lower CD4. But nowadays, I think drugs are available, so anybody who turns positive, we don't. At times, it's not even about how the CD4 is. It's just about whether you have the virus or not. You just have the virus, you started on medication, and that is why we can comfortably say nowadays we don't have a major issue with HIV, but we still have people who are getting HIV, and majority are getting not because they don't know, but I think it's because they are they are um, they're not keen enough, and I think it's just something to do with the stigma, and times wanting to not take responsibility seriously. I hope I've answered you to some extent as far as that is concerned.
Yes, Doctor, you have.
Mm,
Thank you so much.
you're welcome. Now, you, I hope, even as I was trying to answer Ashford, um, I've tried also to answer Martha's TB. TB is a very complicated disease because it can affect every part of the body apart from the nails and the hair. So when you're talking about TB, um, it's a major public health concern, and we really need to think about it on a serious note. But the most important thing, apart from it affecting the whole body, the critical point, and which really concerns us, especially in this particular group, is about knowing how TB is spread. When you know how TB is spread, and that TB has medication, and making sure that every time that we have somebody who has a cough, somebody who has any kind of upper respiratory tract infection, we should, this is now my advice, what I've advised us to do. We should do what we did during the COVID season. If you know you have a cough, if you know you're sneezing, you have a flu or whatever, use that face mask. You're not only protecting yourself, you're protecting your loved ones. If you go to your place of work and you find that there's somebody who is coughing and they're sneezing, and most of the people they just cough if to they don't know how to cough. They don't have cough etiquette. They have forgotten whatever we had agreed during the COVID time. You coughing into or sneezing into your elbow, but they just use either their handkerchief or their hand. And when that happens, this is the same person mtakutana naye, especially us Africans. We like shaking people's hand very well. So I mean very much. So and you don't know what somebody has just done. Pengine umeona amekwambia ngoja kidogo, ametoa handkerchief, ameblow his nose, the handkerchief is already wet, amekusalimia, and times tunaenda to an extent we want like hugging each other. So we need to start thinking critically, especially the time and the season, like where we are in or where we are headed. Why? Because during the cold seasons, this is when you have a lot of viral infection, and most of the viral infection they are transmitted through droplets, either sneezing, coughing, laughing, whatever. So let's watch ourselves. Let's take care of ourselves. The other thing you can be able to do if you can afford, get a vaccine, get a flu vaccine. If you've already gotten a flu vaccine and you still feel like you are exposed, make sure you have I mean, you have vitamin C close by, so that if by any chance you get infected, then because of the vitamin C that you're taking, it helps. Vitamin C and vitamin A helps you to fight all viral infections, and also even when you are sick, it helps you recover fast. So those are some of the tips I'd want to advise you guys to do. And of course, taking a lot of water, because most of the viral infections allow you to, I mean, cause you to have fever and things like that. So, and dehydration is one of the critical issue that makes now people start developing um, signs and symptoms and even start panicking because, like, when you're dehydrated, even if you don't have any kind of infection, uh, you develop either headaches or dizziness. So you can now try to imagine when you have an infection, how that would happen. I mean, how that would affect you. So we leave it at that. So um, these are very critical issues which we need to look at, and also something else before I move out of there is also how do we dispose, especially people with TB. How do they cough? Unakohoa nakohoa, and seriously, you're trying to remove sputum from deep down there, so you're throwing all that bacteria within the atmosphere, and even at that particular time, when you succeed removing that particular sputum, where do you throw it and where do you dispose it? So these are now the critical issues that we really need to find out how to deal with them. That we could talk about that within a home setting. What happens when you have somebody within your home who has a flu or who has any kind of throat infection or respiratory tract infection? How do you dispose the sputum? How do you dispose whatever they are removing? How do you wash? How do you wash them? clothes, or rather the handkerchief that has been contaminated. Are we together?
Yes, we are, Daktari.
Yes, we are.
Yes. And also the other critical thing, especially for those of us who use public transport now, and you know some of you ni wenye wanapenda kukaa kwa dirisha alafu ama wanakaa na huko ndani alafu you insist close that window because umesikia kuna mtu anakohoa hapo karibu na wewe. What happens? How can you be able to sort that out? Are we together? These
Yes,
are
by
critical
insisting
issues.
that windows should not be closed.
Yes, but now you see, most of the time what happens, umeingia kwa hiyo matatu, somebody is coughing next to you, umefungua dirisha, mwingine ako hapo nyuma anakuambia funga hiyo dirisha, nasikia baridi, unafanya nini? Hmm? So how can we be able to educate our people so that at least they make sure a few of the windows are remain open so that air can circulate well in that particular matatu, and whatever you're breathing in at least does not have a lot of concentration of the bacteria that you can be able to pass. I mean, that can infect you. Because for you to get an infection, it all depends on the dose of the bacteria that you get at a single at a single exposure. Are we together?
Yes, we are, Daktari.
Yes.
Yeah. So those are very critical issues, and also the other critical issues that you need to start thinking about, and that is why I told you TB is a public health issue. About the schools, what happens? I remember there's a school I don't want to mention by name, but that's we had a student who had smear positive TB. By the time we realized that, because we tried to trace the contact, and we found that she had spread it to three of her cubemates. So it's not funny, especially when you look at our public schools where you have a lot of congestions in the dormitories and even in the classes because you're trying to make sure that every child gets free education in quotes. But now, when we have sickness or something like that, how do we handle that? Do we have competent people who can be able to advise or to do the necessary stuff so that when we have any kind of outbreak, they are keen enough to make sure that whatever is necessary has been done, also to protect those who have not been infected. And that is why at times it's usually very critical. I'm sure for those of you who have small kids, you have realized that, especially the pre-units and the lower primary, it's like this week ako na dawa, next week ako sawa, after next week amepata something else. If it's not coughing, it's diarrhea. It's not diarrhea, it's coughing again. All this kind of stuff. So, and these are issues to do with contamination. At times it helps because it it's still part of creating the immunity. But all said and done, we need to do something to make sure that we can be able to curtail or reduce the spread of infections within the the community. So I want to leave it at that, and we see whether we can be able to have a conversation. Because when I look at the time, I see like we have only 5 minutes remaining, and so that we can let's hear. I want to hear from your perspective what you think should be done, or what we have what we have discussed today, whether it's making sense, it's not making sense, and how we can go about it. Thank you.
Thank you, Daktari, for such informative presentation and clarifications here and there. Indeed, I've also learned something that once we are sick, to boost our immunity and fast healing, vitamin A and C is very crucial. That's a point that I've taken home, among others. I also believe that we have also learned a lot, though I joined a bit late. I was held up, but I thank God that I have learned a lot. Today, I would wish to we do it a bit differently. Yes, I would just ask Helen, do you have anything to say or to comment? Helen,
Yeah, yes.
yes, can you say something?
Uh, Thank you so much, Doctor, for that insightful conversation. And I wanted to ask something about vitamin C and A. Are you taking it as a medicine or as a supplement? And are you taking it when you're sick, or you can take it anytime? Yeah.
Thank you, Helen, for that. I know Daktari will answer you shortly. I would also like to ask Karen, do you have anything to say or a question to ask? Today we are doing it differently a bit. It seems Karen doesn't have anything to say, but I know she has also learned a lot. Maybe next time she will ask a question or say something. Yes, can you say something, Karen?
Okay, I also came in late, but with that few moments, I've learned a lot, and we'll make sure to work with the supplements, the vitamins A and C, and tutapigana na baridi. Yeah, thank you, Daktari.
Daktari, I think we are all revolving around vitamin A and C. So maybe before we close, you can say something or answer the question that has been asked by Helen. Thank you.
Thank you, Helen, and even Douglas and Karen. Now, um, vitamin C and vitamin A are supplemented. Vitamin C is easily available. You can buy off the counter. But vitamin A is not easily available. Most of the time, is something that has to be prescribed. Why? Because vitamin A has a little bit of some side effects. It's not everybody who is supposed to take it. Vitamin A has teratogenic effects. What do I mean by teratogenic side effects? Teratogenicity is what we call it can affect an unborn child. So that is why it cannot be sold just like that, because there's a few things that we need to confirm before we prescribe that to you. I hope I've made myself clear. Now, it is good, especially in this particular season, to boost yourself with, to boost your immunity with vitamin C. Now, when it comes to vitamin A, I've said something about it, but you can still be able to find some multivitamins that have traces traces of vitamin A, but I don't want to dwell so much on that. But if you need vitamin A, always make sure you see your clinician, they'll advise you accordingly. Now, there's something that is very important, and I think I don't know uh, how you think we can be able to address it. And this is the issue of exposing ourselves to some of these viruses or bacteria. What do you think we can be able to do as members of the community to lower your chances of being exposed to these viruses and to the TB bacteria and many other bacteria that can be passed on from one person to another through droplets? What do you think we can be able to do?
I personally think that this forum is teaching us a lot. We are learning a lot. So if we are able to pass the same message to as many people as we could, we will play a very crucial role in informing the members of the community on how to take care of their health, especially when it comes to issues like TB. And also at the same time, I think I don't know what those who are concerned are doing about it, so that the masses can be enlightened about more about TB and its effects and how we can counter it and reduce it. That's my thinking.
Thank you. Any other suggestion?
Doctor, I think the most important thing is awareness,
Okay.
and this is something that needs to be approached from all over. Okay, for our sake, probably we can, for in our case, we can try to sensitize people around us. But on a bigger picture, I think we should even approach religious groups, any other groups, and have a few people trained so that they can be able to help others know about it, because it's all over. And I think if we have people who are sensitized about it and they're able to continue sensitizing others, we can get somewhere. My feeling.
Yeah, that's very true, especially in places like churches. Imagine your praise team sharing microphones and all this kind of stuff, and when you're talking, saliva jumping from, and somebody else comes to take the same. You're trying to do, you know, when you think about some of these things, let me leave it at that. But we need to sensitize people, and we need to be very sensitive. Um, and also, something we had learned 2 years ago, washing of hands. And making sure you're only shaking hands when it's absolutely necessary. And when you shake hands, make sure you don't touch your face or anything to eat before you wash your hands. Be sensitive. Don't usikuwe na maringo ukatae kusalimia watu. Shake hands. But when you see somebody doing something like what you've just talked about, ametoa handkerchief, ametoa makamasi ukiwa hapo, alafu anataka kukusalimia na hiyo mkono ilikuwa imeshika hiyo hanky, just decline in a polite way. And then you make sure when you go home, before you touch other things or before you do any other stuff, make sure you have wash your hands. So I think I'd wish to leave it there. Unaona kuna mkutano ingine ninaitwa. I'm supposed to be chairing. Na nimeona time yetu imeenda. It's around 8:35. I think we can close this so that you give me time to join the other group if that is okay with us.
I think
Absolutely.
this is okay with it. It's okay, Daktari, but I still believe that maybe I don't know whether we have covered it exhaustively or we are going to continue next Thursday on the same topic, respiratory system.
I'll look at it and I'll let you know
Oh,
before the end of the day tomorrow.
okay, Daktari. So
Yeah,
that we allow you to also join the other meeting that you're chairing. I think
yes.
at this juncture, I would like to close this forum. And let me say that we are really grateful for those who are participating, and also we believe that more will be joining us in future. And I think we saw that James was able to send the test run, and it is in YouTube. Let us all subscribe and share widely so that we can get as many people joining us so that they can also benefit. And I don't know whether James, you want to say something, or I just conclude.
Because of time, kindly conclude. Thank you.
Okay, thank you, Sir James. With those few remarks, let me say with that, I want to thank all of us for having participated. Let us, and also not forgetting Daktari. Thank you, Daktari. I don't know what more I can say, that you make us to be more informed, and also we share we share the same information with our friends, and we are very grateful for sparing your time and giving us this information. We do not take it for granted. May God bless you very much. Also, James, thank you very much for the IT site, and all the
Welcome.
participants. Thank you for participating, and God bless you. So let us have a blessed week. We meet next time in the same forum. God bless you abundantly, and have a good night and take care. Thank you very much.
Bye bye.
Thank
Good
you.
night.
Good night.